Assalamu alaikum. This is the second lecture in the central nervous system. Bismillah ar-Rahman ar-Rahim. In this lecture, we will describe the pain temperature crude touch pathway from the body, and we will apply this knowledge to some clinical points that are very important for the MCQ questions. We will describe the remaining 4 ascending tracts in spinal cord, and we will list the fixed ascending tracts in the spinal cord that can be seen in every section in the spinal cord. We'll start by the pain and temperature pathway. First, the receptors are the free naked nerve fibers present in the epidermis, and of course take care that we are talking about the fast pain and not the slow pain. Then these impulses will be carried from the receptors to the first order neuron, which is present in the spinal ganglion or dorsal root ganglion. Here the small cells in the spinal ganglion is the one responsible to carry these sensations, pain and temperature. These sensations will be carried by the peripheral branches of the small cells, and the peripheral branches are thin myelinated. So the cells are small and the peripheral branches are thin myelinated. Then the central branches will enter the spinal cord through the lateral division of posterior root. Remember that the medial division is carrying the central fibers of the larger cells in the posterior root ganglia, carrying proprioception and fine touch. Then the fibers will ascend 1 or 2 segments. Some fibers will descend 1 or 2 segments. Some fibers will relay at the same level in the second order neuron. So the ascending or descending, or those entering here, they will relay finally in the second order neuron. These fibers ascending and descending are within the spinal cord, so they are short tracts formed of ascending and descending fibers. This tract is called Lissauer's tract. Lissauer's tract, so it is belonging to the first order neuron in pain and temperature pathway. Then, after that, the second order neuron will start its job. It is the cells present in the substantia gelatinosa of Rolandi, present at the tip of the dorsal horn or posterior horn. The axons of these neurons in this nucleus will cross to the other side in front of the central canal, very close to the central canal. The crossing fibers, of course, some of them will pass in the gray commissure and some will pass in the white commissure. The gray commissure is this bridge, the white commissure is this bridge. So some of the fibers will pass in the gray matter and then in the white matter, and some will pass in the white matter and finally will reach the lateral column of the white matter to form the lateral spinothalamic. The lateral spinothalamic tract occupying the lateral column of the white matter, and it is a long ascending tract that will pass through the whole length of the spinal cord and then will reach the middle level of the pons, where it joins the ventral spinothalamic tract to form the spinal lemniscus. Then the fibers of the spinal lemniscus will reach finally the ventral posterolateral nucleus of the thalamus, and here we will start the third order neuron, where the axons of this nucleus will pass through the posterior limb of internal capsule, through the sensory radiation in corona radiata, and finally reach the postcentral gyrus sensory area 312. Here it is a picture to demonstrate the internal capsule, which has an anterior limb, geno, and posterior limb. In the posterior limb, we have the fibers carrying sensations from the body passing in this posterior limb. And then in the sensory radiation to reach the sensory area. We will reach the sensory area by passing through the sensory radiation of the corona radiata. Then we will summarize what we have said. The first order neuron is the small cells in the dorsal root ganglion, which have thin myelinated peripheral branches that carry the impulses from the receptors. And of course we are talking about the fast pain or rapid pain, not slow pain. And then the central branches will enter through the lateral division of posterior root, and some of the fibers will ascend up or descend down 1 or 2 segments in the Lissauer's tract before ending in the second order neuron. The second order neuron for pain and temperature is the cells in the substantia gelatinosa of Rolandi on the same side, and the axons will cross to the opposite side in front of the central canal in the gray matter and very close to it, passing through the gray and white commissure, where here we will form in the lateral column the lateral spinothalamic tract that will join the ventral spinothalamic tract in the pons to form the spinal lemniscus, and finally end in the third order neuron, which is the ventral spinothalamic nucleus of the thalamus. The axons ascend in the posterior limb of the internal capsule, then pass in the sensory radiation to reach the sensory area in post-central gyrus area 312. So here the arrangement is not correct. We will start first by the, here we are missing in this description the posterior limb. So the ventral posterolateral nucleus, the axons will pass in the posterior limb of internal capsule, then in the sensory radiation to reach the sensory area in post-central gyrus of cerebral cortex area 312. And here you can see the animation of this pathway, which is the pain and temperature pathway. Again, the receptors are the free nerve endings in the epidermis, which are carried by the peripheral branches thin myelinated of the small cells present in the posterior root ganglia or spinal ganglia. The central branches will enter through the lateral division of the spinal nerves and of the posterior root of the spinal nerve. Some of the fibers will ascend 1 or 2 segments, and some will descend 1 or 2 segments to form the Lissauer's tract that will finally end in the second order neuron, which is the substantia gelatinosa of Rolandi. Then the cells, the axons will cross to the other side to form the lateral spinothalamic tract, passing through the gray commissure and in white commissure to reach the collection in the lateral spinothalamic tract. And this tract will be present in all the levels of the spinal cord, and in the middle level of the pons it joins the ventral spinothalamic to form the spinal lemniscus in this position. Then the fibers of the spinal lemniscus will pass to the third order neuron, which is the ventral spinothalamic nucleus of the thalamus, and the fibers will pass through the posterior limb of internal capsules, then through sensory radiation in corona radiata to reach the post-central gyrus area 312. Here we have some clinical application which is important for the MCQ. Any lesion in the lateral spinothalamic tract, which is a second order neuron, will result in contralateral loss. Why contralateral? Because it is the fibers of the second order neuron after the crossing, so the loss will be on the other side. What loss? Loss of the pain, temperature, and where? Below the level of the lesion. So you can test that in your patient by pricking the skin. If he feels the pain prick, he is good. If not, he is losing this pain sensation. Also, you can test the temperature sensation by using 2 test tubes containing frozen water and hot water to test the hot and cold sensation in the skin. Then we will move to the crude touch pathway. Here the receptors are the following. We have the free nerve endings exactly like the pain and temperature pathway. These are the free nerve endings. We have also the nerve endings that are mentioned in the fine touch, which is the Merkel disc and the Meissner corpuscle. In addition to a new nerve ending special for this crude touch, which is the peritracheal nerve fibers around the hair follicles. So we have 4 receptors, 2 with the letter M and belonging to the fine touch, and 1 with the pain and temperature pathway, and a new one which is specific here, which is the peritracheal nerve endings to feel touching of the hair or moving of the hair. Then after that, these impulses will be carried by the peripheral branches of the first order neuron, which is the medium-sized cells present in the spinal ganglia. The cell is medium in size and the peripheral branches are medium-sized myelinated nerve fibers. The central branches will enter through the medial division, like exactly the fine touch and proprioception, medial division of the posterior root, and also the fibers will ascend few segments above and descend few segments below before the relay in the second order neuron. Here in the second order neuron, it is the main sensory nucleus, or it has another name, nucleus proprius. The axons will cross to the other side, but not so close to the central canal like that of pain and temperature, and they also pass in the gray commissure and white commissure to reach the anterior column of the white matter. So we are saying that the fibers are crossing very obliquely to demonstrate that they are not close to the central canal, and finally reach the ventral column or anterior column of the white matter to form the ventral spinothalamic. The ventral spinothalamic tract will be present in all the levels of the spinal cord, and in the level of the middle pons it joins his brother, which is the lateral spinothalamic, to form the spinal lemniscus. And then fibers will pass to the third order neuron to reach the ventral posterolateral nucleus of the thalamus. The axons will pass through the posterior limb of internal capsule, sensory radiation, postcentral gyrus 312. Here again, the first order neuron is the medium-sized cells in the spinal ganglia. Peripheral branches are medium-sized myelinated, and they pass through the medial division of posterior root. Take care that letter M is very evident in this pathway. Then the fibers will ascend and descend few segments before synapsing with the main sensory nucleus, which is the second order neuron, which has another name, nucleus proprius. And by that it gives, while ascending and descending, it gives collaterals for many nucleus proprius. Then we have the second order neuron, which is the nucleus proprius or main sensory nucleus, again the letter M, the axons of which will cross to the other side in the white commissure and gray commissure to form the ventral spinothalamic in the ventral column, and ascends in the brainstem, where it joins in the middle level of the pons the lateral spinothalamic to form the spinal lemniscus, to end in the third order neuron, which is the ventral posterolateral nucleus of the thalamus. Here we will see the animation, the medium-sized, the ascend and descend, and then we have the main sensory crossing ventral spinothalamic, spinal lemniscus, the third order neuron, ventral posterolateral nucleus, posterior limb, sensory radiation, postcentral gyrus area 312. What are the written questions in this area? We have the pain and temperature pathway, direct question. Crude touch pathway, direct question. And then we have lateral spinothalamic, ventral spinothalamic, and spinal lemniscus. Let us now see how you will answer the lateral spinothalamic tract. Here you should mention the following. You should mention definition, origin, course, termination, function. By definition, it is a long ascending sensory tract in the spinal cord. By the origin, it is the substantia gelatinosa of Rolandi of the opposite side. Of course, it is formed after the crossing. By the course, you should comment on 3 points. It is a crossing tract, and it occupies the lateral column of white matter, and it joins the ventral spinothalamic at the level of the middle pons, and then the termination VPLN, and finally the function pain and temperature from the opposite side of the body, because it is a second order neuron fibers that are crossing now. So it is responsible for pain and temperature pathway from opposite side of the body. Of course, and it is present in all the levels of the spinal cord. Ventral spinothalamic tract, as regards the definition, the same definition. As regards the origin, the cells of the main sensory nucleus of the opposite side, because it is a second order neuron fibers that cross and occupy the ventral column and join his brother lateral spinothalamic in the middle level of the pons to form spinal lemniscus. The termination VPLN, the function is the crude touch from the opposite side of the body. Here we have a table to compare these two tracts and to demonstrate what are the common statements in these two tracts. By definition, they have the same definition. Origin SGR MSN. Both are crossed. This is in the lateral, this is in the ventral. Both join each other in the middle level of the pons to form spinal lemniscus. The same termination. Here we have pain and temperature from opposite side of the body. Here we have crude touch from opposite side of the body. Then we want to answer the question about the spinal lemniscus. Here in the spinal lemniscus, you should first define it. It is an ascending sensory bundle formed by the union of the lateral and ventral spinothalamic tract, as we said before, in the middle level of the pons. What is the course? It is formed in the pons and continue its journey in the midbrain to reach the thalamus as a third order neuron. The termination ventral posterolateral nucleus, and the function, it is responsible for the pain and temperature and crude touch from the opposite side of the body. This is the pain and this is the crude touch from the 4 receptors, and this is from the free nerve endings from the opposite side of the body. Clinical point: syringomyelia. Syringomyelia is a congenital disease in which there is a dilatation of the central canal in a certain area, not in all the spinal cord, in the lower cervical and upper thoracic region. It is common in the female. By pressure on the crossing fibers of the lateral spinothalamic tract, there will be bilateral loss of pain and temperature in the upper limb and in the chest. The lateral spinothalamic tract is intact, so the sensations above and below are normal, and in this condition the touch is felt because the fibers of the crude touch are away from the central canal, not affected, and also the fibers of the fine touch are far away. They are passing with the gracile and cuneate in the dorsal column, of white matter. So it is a dissociated sensory loss, as we have some sensations are preserved and some are lost. In this picture, you can see that here the area in this animation, here in the area upper cervical, we have the normal impulse and the crossing normal, no pressure on the crossing fibers, and they join the lateral spinothalamic tract. This is above the affected region. In the area below the affected region, here also the impulses are very normal and join the lateral spinothalamic tract, and it continues its journey above. But here in the affected region, which is involving few segments from the lower cervical and upper thoracic, here the crossing fibers are damaged and not joining the lateral spinothalamic. So we have a loss in certain area only, but above and below this area there is normal sensation because the crossing fibers are normal and they join the lateral spinothalamic, which is intact. But here in the affected area, the crossing fibers are damaged, but the lateral spinothalamic tract is normal, but it does not receive impulses from this area. Some of the students asked that we have here Lissauer's tract. Why the Lissauer's tract does not compensate for these damaged fibers? Remember that the Lissauer's tract fibers ascend 1 or 2 segments above or 1 or 2 segments below, and this is not one segment, it is lower cervical, upper thoracic. You can imagine that it is about 6 segments, at least 6 segments, so that if we escape this loss from the upper 1 or 2 or upper or lower 1 and 2, still there is a loss in the area, because it is not one segment, it is various segments. We have the lower cervical segments, say 4, and upper thoracic, say 6, so they have about 10 segments. If we escape from the upper 2 and lower 2 due to the Lissauer's tract, still the middle 6 will be affected. Here we have the general rules for the sensory pathways. The first order neuron is always in the spinal ganglion in the same side. The third order neuron is always in the thalamus on the opposite side. The second order neuron accordingly should be present or should be crossing, because the first on the same and the third on the opposite, so the second should be crossing. The second here is either in the spinal cord in the medulla of the same side, but the fibers will cross. Here we have pain and temperature and simple touch in the spinal cord, while the proprioception and fine touch in the medulla. The crossing of the pain and temperature and the crude touch in the spinal cord, while the proprioception and fine touch crossing in the upper half of closed medulla in the sensory decussation. Here we have a comparison, very good comparison between the 3 sensations or 3 pathways from the body: the receptors, the first order neuron, the second order neuron, and the third order neuron. You can see here that the third order neuron is the same. The receptors will vary, of course. Here we have muscle spindle, tender spindle, Pacinian corpuscle for proprioception. For fine touch we have MRM, Meissner, Raffini, and Merck. In the crude touch we have the free nerve endings, the peritracheal, and the Merkel and Meissner, while the pain and temperature we have the free nerve endings. In the first order neuron, they are all in the spinal ganglia, but here we have the larger cells in the crude touch, which likes the letter M in the medium-sized cells, and here the pain and temperature in the small. Remember that the larger cells have thick myelinated, the medium have medium-sized myelinated, the small have thin myelinated. The proprioception and fine touch and the crude touch, they pass through the medial division or posterior root, while the pain and temperature in the lateral division. Gracile and cuneate, here the second order neuron in proprioception and fine touch. Of course, they are present on the same side. The nucleus is on the same side. The same on the same side here, but the main sensory nucleus, remember the letter M. And here we have substantia gelatinosa over. But their axons, the nuclei, are on the same side, but their axons should cross to the other side. Here the crossing in the medulla to form the internal arcuate fibers that will form the medial lemniscus. Here the crossing in the spinal cord to form the ventral spinothalamic and lateral spinothalamic that will join in the pons to form the spinal lemniscus. And here we have the substantia gelatinosa, the axons will cross to the other side to form the lateral spinothalamic, and in the pons they join the ventral spinothalamic to form the spinal lemniscus, and the third order neuron is the same. Now we are left with the 4 subcortical ascending tracts that will not reach the cerebral cortex. They carry sensory impulses, but these impulses are not felt as sensation. These are carrying sensation, these are carrying sensory impulses to subcortical level. We have finished the gracile, cuneate, lateral, and ventral spinothalamic, and we are now left with the dorsal spinocerebellar, ventral spinocerebellar, spinotectal, and spino-olivary. Now, we will start by the dorsal spinocerebellar and the ventral spinocerebellar. As regards, they are ascending sensory tracts not reaching the cerebral cortex and they end at subcortical level. Then we will discuss the other two subcortical ascending tracts. We have the spino-olivary for the inferior olive of the medulla and the spinotectal for the tectum of the midbrain. Then start with the dorsal spinocerebellar. In the dorsal spinocerebellar, actually you can consider it is the second SPI that carries proprioceptive impulses to the cerebellum. The first SPI was the external arcuate fibers discussed in the previous first lecture. Then we have here the second SPI, which is a dorsal spinocerebellar. The proprioceptive impulses that reach the larger cells in the dorsal root ganglia will pass upwards in gracile and cuneate, but some of the fibers or some of the impulses will reach to a certain nucleus called Clark's nucleus. It extends from C8 to L2, of course including the thoracic segments. So it is similar to the sympathetic nucleus in the lateral horn, except that it increases by having what segment, which is the cervical 8 segment. Here this is the Clark's nucleus in C8 and this is the Clark's nucleus in the L2. In between them we have also Clark's nucleus. This nucleus will receive these proprioceptive impulse from the large cells in posterior root ganglia, and the axons will pass to the white matter to form the tract called dorsal spinocerebellar. Why it is called dorsal? Because under it, in the same lateral column, we have ventral spinocerebellar. Why it is called spinocerebellar? Because it carries the impulses from the Clarks to the cerebellum, entering through the inferior cerebellar peduncle, connecting the cerebellum with the medulla. So it carries these proprioceptive impulse for the cerebellum in order to have an equilibrium and coordination in your movement. Then this is the origin. The origin is from the Clark's nucleus from C8 to L2, and the course it ascends on the same side, so it is a direct tract. Remember, dorsal spinocerebellar is a direct tract passing on the same side of the body. And of course take care that it is a second order neuron, because the first order neuron is the larger cells in the dorsal root ganglia. Then these proprioceptive impulses will be taken from this first order neuron, and then this SPI will carry the impulses to the cerebellum, which is the final destination, through the inferior cerebellar peduncle. So remember, it is present in the lateral column of the white matter in all the level except below L2. So in your drawing you have L3. So in your drawing for the lumbar L3, you don't have a dorsal spinocerebellar because it is absent after the L2. And after it originates, it ascends up to reach the inferior cerebellar peduncle, so it passes in the medulla to enter finally the inferior cerebellar peduncle to carry the proprioceptive impulse from where? From the trunk and actually the upper part of the lower limb. So this area, the proprioception from this area will be carried to the cerebellum by this special tract, dorsal spinocerebellar tract. Also, we have another SPI, which is a ventral spinocerebellar tract, and its order now it's number 3. Number one external arcuate fibers. Number 2 dorsal spinocerebellar. Number 3 is a ventral spinocerebellar. Here again, it is a second order neuron. The first order neuron in this unconscious proprioception. What is the meaning of unconscious? The proprioception that will not reach the cerebral cortex. The proprioception that will reach the cerebellum. This is the unconscious proprioception. Why? Because it cannot be felt. It is sensory impulses reaching the cerebellum to perform its function. Here, the first order, as usual, the larger cells in posterior root ganglia, but in this condition, will give some impulses to these lamina 5, 6, and 7 in the gray matter. Lamina, it is a layer containing nerve cells or nucleus, and they are called now lamina 5, 6, and 7. These 3 laminae will get these impulses and will send their axons towards the white matter in the lateral column in both the same side and the opposite side. So it is both on the same and on the opposite. It is direct and crossed to form the ventral spinocerebellar that will ascend in the spinal cord. Where can you find these laminae? What is the origin? Here, these laminae that carries this proprioceptive impulse are present, are taking these impulses in the lumbosacral region, so that the tract will be present in all the levels of the spinal cord as it starts from lower down, so it will complete its journey till the end of the spinal cord and also till the medulla. Here we have these 3 laminae that will first take the in the lumbosacral region, that will take their proprioceptive impulse from the first order neuron and give the second order tract, which is the ventral spinocerebellar, that will give its impulses to the cerebellum, but take care, it enters the superior cerebellar peduncle. Although it is present lower than the dorsal, it enters the higher arm, while the dorsal, which is up, it enters the lower arm. So this tract also is characterized by being present in all the levels of the spinal cord, which is the third SPI here in our story. Here it terminates in the cerebellum by entering the superior cerebellar peduncle, and it carries the proprioception from the lower limb to the cerebellum. Now the dorsal spinocerebellar and the ventral spinocerebellar can be seen in this animation. Here we have the dorsal spinocerebellar, the Clark's nucleus, and here it enters through the inferior cerebellar peduncle. Here we have the laminae 5, 6, 7, and the axons will pass to both the same side and the opposite side and form the ventral spinocerebellar that enters through the superior cerebellar peduncle. Take care, the higher tract enters the lower arm and the lower tract enters the upper arm. Here the comparison between the two. The dorsal spinocerebellar, or sometimes called posterior spinocerebellar tract, and this is anterior spinocerebellar tract. This one originates from the Clark's nucleus, which is called nucleus dorsalis. Take care from the other names. It extends from C8 to L2. It is a direct tract, and it receives proprioception from the larger cells in dorsal root ganglion. On the other side, here the cells in the posterior horn in the lumbosacral regions, lamina 5, 6, 7, in the lumbar with sacral and coccygeal. So it starts from lower down, and it passes on the same side on the opposite side and carries proprioception from also, this is one common feature, the first order neuron in both is the same, which is the larger cells in posterior root ganglion. As regards the course, both are present in the spinal cord, but this is present higher up in the lateral column and lower down in the lateral column. This is present in all the levels except the medulla, and also in the closed medulla, except in the lumbar, except in the lumbar and also the closed medulla. And this one is present in all the levels of the spinal cord and as well as the brainstem, all of the brainstem, as it enters through the superior cerebellar peduncle. So it is present in the whole brainstem and leaves the brainstem through the superior cerebellar peduncle connected to the midbrain. The termination both terminate in the cerebellum, and this one through the inferior cerebellar peduncle it enters, and this one enters through the superior cerebellar peduncle. This carries proprioception and it is from the trunk and lower limb, and this is from the lower limb only. And this of course is used in coordination of the individual limb muscles and maintenance of the posture. Now, the fourth SPI is the SPI carrying the proprioception for or from the upper limb. Here also the larger cells in dorsal root ganglia will give some impulses that will pass in branches that ascend in the spinal cord till the closed medulla to reach a nucleus very close to the cuneate nucleus called accessory cuneate, and it gives these impulses from the upper limb to reach this accessory cuneate nucleus, and then the accessory cuneate nucleus will give the impulses to the inferior cerebellar peduncle to reach the cerebellum. So from the upper limb, remember the upper limb here has also its own special connection, where the larger cells in the posterior root ganglia in the area supplying the upper limb will give impulses to the accessory cuneate, and then the axons of accessory cuneate will enter the cerebellum through the inferior cerebellar peduncle, and this is the SPI number 4. Here we have the last SPI, or the last member in the unconscious proprioception, is the spino-olivary. Here also the larger cells in posterior root ganglia, which is the first order neuron always, will give impulses to the lamina here 5 and 4. Remember the ventral spinocerebellar 5, 6 and 7. Here we also have 5, but 5 and 4, and in this lamina present in all the levels of the spinal cord will carry these impulses here, and the axons will cross to the other side to form the spino-olivary tract that will ascend to reach the inferior olive, and from the inferior olive pass to the cerebellum through the inferior cerebellar peduncle. Here it is present in all the levels, as these fibers are present in all the levels, while the dorsal spinocerebellar was in all the levels except the lumbar below L2, and the ventral spinocerebellar in all the levels, and this one is also present in all the levels. So it carries the proprioception from the spinal cord, from all the body, from the opposite side, because it is a cross tract to the cerebellum. Now it is the last one in the unconscious proprioception. Now we are left with the remaining ascending subcortical tract, which is the spinotectal. The spinotectal here arises from, it is a second order neuron also, and it is crossed and it is present in all the levels of the spinal cord. The first order neuron are the neurons responsible for carrying the pain and temperature and the crude touch, which will reach the spinal cord and carrying their sensation, but some of the fibers will reach the lamina 1 and 5. 5 also. 5 is present in the 3 pathways: the ventral spinocerebellar, the spino-olivary, and the spinotectal. Here they are present in all, these fibers are passing in all the levels of the spinal cord, but cross to the other side to form the spinotectal. So it is a cross tract, and it is present in all the levels of the spinal cord, and it reaches the tectum of the superior level of midbrain, which contains the center for visual reflexes. What is the importance of this tract? Here, if you have been touched by your on your right side, or you have been touched by pinprick on the right side, you will turn your eyes and head to the source of stimulation. So there is a coordination between spinal sensation and the visual reflex, spino-visual reflex. So this is the function of the spinotectal tract. Now we are left with this exam hint. What are the tracts that are present in all the levels of the spinal cord? We have 6 out of 8 ascending tracts. We have gracile tract, we have the ventral spinocerebellar because the dorsal is not present in L3. We have the lateral spinothalamic, we have the ventral spinothalamic, we have the spinotectal and the spino-olivary. So these are the fixed tracts that are present in all levels of the spinal cord. The last question here is to collect what we have said in the previous lectures. How and why the cerebellum gets information about proprioception, or in another meaning or another sentence, what is the unconscious proprioception? Of course, the cerebellum should get information about the proprioception in order to coordinate the movement of your muscles and to keep your posture. If it does not take this information, this function will not be fulfilled. So what are the pathways of the unconscious proprioception? Again, we have another question. What happens to proprioceptive impulses after entering the spinal cord? Now, here, this is one way for the proprioceptive impulse when it enters the spinal cord. The spinal cord here, after receiving the proprioceptive impulse, will form the gracile and the cuneate tracts that will reach the gracile and cuneate nucleus, and then will reach the ventral posterolateral nucleus of the thalamus and then the sensory area. So this is the first major pathway for the proprioceptive impulse when it enters the spinal cord. This is the main pathway. Then we have the unconscious proprioception pathway, which is composed of 5 components. We have the external arcuate fibers, the posterior entering directly the inferior cerebellar peduncle coming from gracile and cuneate in the upper half of closed medulla, and the anterior will cross to the other side to relay in the arcuate nucleus and then enters the anterior part of the inferior cerebellar peduncle to reach the cerebellum, carrying the proprioception from all the body. This is the spine number 1. Here the spine number 2, which is the dorsal spinocerebellar, receiving impulse from Clark's, which is present in C8 to L2, that received proprioception from the larger cells in posterior root ganglia. And it enters the cerebellum on the same side through the inferior cerebellar peduncle. And it is present in the spinal cord except in the lower lumbar, or after L2, it is not present after L2 segment. Here we have the third spine, which is the ventral spinocerebellar tract, which receives the impulses from the lamina 5, 6, and 7, and it is a second order neuron passing on the same side and the opposite side, and enters the cerebellum through the inferior cerebellar peduncle, carrying the proprioception from the lower limb. Here the spine 3. The spine 4, it carries the proprioception from the upper limb only, where the impulses reach the accessory cuneate to form these fibers, cuneo-cerebellar fibers, passing through the inferior cerebellar peduncle, carrying proprioception from upper limb. And finally, we have the last spine, which is the spino-olivary, carrying proprioception from all the body, but from the opposite side, as the fibers of the proprioception will reach from the first order neuron to the second order lamina 4 and 5, lamina 4 and 5, to form the crossing fibers of the spino-olivary that will reach the inferior olive in the closed medulla and in the open medulla, of course, and then enters the cerebellum through the inferior cerebellar peduncle. So this is the last one in the unconscious proprioception. Again, the first pathway is the conscious proprioception, the second pathway is the unconscious proprioception, and the last pathway is the fibers that will descend to reach the anterior horny cells in the upper half and in the lower half of the body in order to complete the stretch reflex arc that will be discussed in the third lecture. These fibers are called septomarginal in case of the gracile and coma-shaped in case of cuneate tract, and this is one of the short tracts that will complete stretch reflex arc and to maintain the muscle tone, and this will be discussed with the short tracts. So finally, the destinations of the proprioceptive impulses entering the spinal cord are 3: the conscious proprioception, the unconscious proprioception by the 5 spines, and finally the short tracts that will descend to reach the anterior horn cell to complete stretch reflex arc to maintain the muscle tone. Thank you very much.